morning and welcome to Public Health Network Cymru's webinar series. My name is Christian Heathcote Elliott and I'm a Principal Public Health Practitioner for the Wider Determinants of Health Unit. Many of the challenges involved in public health that we face in Wales today, such as the climate change emergency or cost of living crisis, are what are sometimes called complex messes. These messes occur in systems which involve many parts. They act in ways which are hard to predict, and changes in one part of the system can lead to both intended and unintended consequences. With complex messes, such as the climate change emergency, there are multiple perspectives in terms of defining the situation, what are desirable outcomes, and how to change the system. Tackling these complex messes, it requires collaboration and partnership between many organisations, and yet research shows that strategic partnerships find it difficult to reach agreement. Today's webinar will focus on the work of the Public Services Boards in Wales as a key body identified in the Wellbeing of Future Generations Act. I'm therefore really pleased to welcome our two speakers, Kevin Grissus and Dr. Elizabeth Woodcock. Kevin is Head of Local Partnerships in Welsh Government and leads the work to review on regional partnership arrangements and is responsible for supporting the Public Services Boards in Wales to deliver their local wellbeing plans. Elizabeth is a research fellow at the University of Birmingham and focusing currently on exploring the collaboration in the context of social prescribing schemes. Her presentation today is based on research she undertook for her PhD in sociology and social policy at Bangor University. Prior to this research experience, Elizabeth has spent many years working with community practitioners in Wales to support new families to introduce Welsh as well as English and other languages to children. Before we move on to our speakers, just a couple of housekeeping rules today. After their presentations, there will be a chance for you to ask questions to our speakers. Please use the chat bar to type in your questions throughout the webinar. We welcome correspondence in English in Welsh contributions. The webinar today is recorded and will be made available on the Public Health Network Cymru's website after the webinar. If you experience any difficulties with the technology today, please let us know through the chat and the team will contact you directly. And we will be using, during Elizabeth's presentation, Microsoft Team polls, and these should be fairly easy to follow. So I'm now going to hand you over to Kevin, who's going to give us a short introduction to the work of Public Services Boards in Wales. Thank you.
Branda, dwi'n falch bod yma heddiw, so good afternoon. I'm proud to be here this afternoon. Just to introduce the concept of partnership working, why we do it, why it outweighs the complexities, and give particular context to Public Services Boards in Wales. So Christian's covered some of this, but the Wellbeing of Future Generations Act, which was enacted in 2015, recognised that the system is an interconnected one, that everything is connected to everything else, and that there are some complex problems, complex messes perhaps, which Christian mentioned a couple: climate change, poverty, which has been exacerbated by the cost of living crisis, biodiversity, health inequalities. It is difficult to pull on one thread without there being effects elsewhere, and to take it from the other side, a coherent systems thinking approach may actually be a very efficient way of solving a problem if we can pull it off. So since we can't siloize, if that is a word, some of these issues, partnerships is a natural way of taking it forward, but as we touched on, very complicated. On the plus side, Wales isn't a very difficult country to traverse. We can, even easier now with technology, we can oftentimes gather the leaders into a single room or two and have conversations. So surely it shouldn't be insurmountable, should it? I've mentioned the Wellbeing of Future Generations Act did a couple of things. It enacted the 5 ways of working, which are collaboration, involvement, integration, prevention, and long-term thinking, but quite, I wouldn't say first among them, but certainly one of the important ones is collaboration, because without collaboration, the others will not succeed. And so it's really helpful to have the conversation today, exploring really the extent to which collaboration is happening across public services boards and how we might make it more successful. Just briefly, if you're not familiar, public services boards are statutory partnerships, broadly speaking on a local authority footprint, but some have merged. So in Gwent, the 5 local authorities on the same footprint as the health board, same as in Bridgend, Rhondda, Tap and Merthyr. We've got the 3 have merged to overlay with the Cwmtâp Morgannwg health board. There are other examples as well. So the legislated statutory partnership, once every 5 years, they have to assess well-being in the area, economic, environmental, social, cultural. And based on that assessment and the priorities emerging from that assessment, 12 months after the assessment, they develop a plan. There are statutory members, fire and rescue, Natural Resources Wales, local authorities, health boards, statutory invitees, which include the voluntary sector, Police and Crime Commissioner, police, the Welsh Minister's representative, and there'll be others as well. And they can invite anyone else that they see will help them to achieve their aims in delivering their wellbeing plans. The key thing is that they are usually bodies who already have wellbeing objectives or have mutual aims, whether it be to reduce carbon cost or output or to help people in poverty. And so they are using existing efforts and monies and resources to meet mutual goals. And that presents a challenge because sometimes thinking in a systems way and offering up something to help another part of the system, which will help you down the line, is an individual leadership challenge for some of these organisations. I'll pause there. I only wanted to talk about why these partnerships exist, but the work of Dr. Woodcock is really important in exploring how to make it happen, who to work with, what to do. So I'll leave her with a tough question. Thank you very much for your time. Diolch am eich amser.
Diolch yn fawr iawn, Christian a Kevin am y cyflwyniad yna. Dwi'n just yn rannu y sgrin wan efo chi. Gobeithio bod chi'n gallu gweld o. Mae'n fraint gen I fod yma efo chi heddiw yn I allu trafod yr ymchwil. Thank you so much for this opportunity to discuss my research with you. It's a real pleasure to be here. Just trying to make the screen move on. There we go. A bit of a delay. Okay, so I'm going to try and answer 3 main questions today. The first is, why was this research needed anyway? The second, what did we find out about what factors affect collaboration in the Public Service Board and other partnerships? And also, thirdly, what did we find out about how we can craft more collaborative working relationships? I'll pause after the first 2 sections, just so to reflect on your experiences and see how those are similar or dissimilar to each other and to the things I found out in the research. And then at the end, there'll be more time for us to have a longer discussion. So please, throughout the presentations, put questions and comments in the chat, and Christian will collate those and help me at the end to answer them in groups of similar topics. And I'll leave you with a challenge at the end. So the first question I wanted to answer was, why was this research needed? Well, in the early days of the Wellbeing of Future Generations Act, in different events around that legislation, public services boards expressed concerns about the principle of collaboration. They wanted to know, is it going to add value to the work of our individual organisations? And they reflected on the experiences of the predecessor, the local services boards, and the particular label as being a talking shop. And they wanted to know, to be confident really, are we going to be able to act on our plans? And those concerns are expressed in a large body of evidence internationally that shows that strategic partnerships frequently fail. They fail in 3 main ways. First, strategic partnerships often fail to include the voice of communities, which makes them less democratic than current local authorities with elected representatives. Secondly, strategic partnerships often have one or two partners who are more influential and more dominant than others within that partnership decision making, making them less mutually accountable and democratic within the partnership. And thirdly, strategic partnerships are often controlled and largely influenced by regional and central government rather than by the local members and local concerns of the local community, which disrupts that existing relationship we have between central and local government in Wales. So what I wanted to know in this research was, well, is Wales any different? Does the Wellbeing of Future Generations Act and similar legislation set up a more collaborative culture in Wales? Are public services boards designed and established in a way that enables collaborative partnership working? I used three main methods to try and answer these questions with a public services board. The first main method was that I observed the Gwynedd and Morn Public Services Board for just over 2 years by attending all their meetings during the first wellbeing cycle. I'm really grateful to them for that extended opportunity to really understand how a PSB works and for all the efforts every member of that PSB put into helping me with this research. They were really helpful. The second main measure I used was that with the help of the PSB members and my other main research member partner, North Wales Wildlife Trust, we established 2 core research groups with members of public bodies and third sector organisations. We engaged in action research to try to find out more about the constraints and dilemmas of partnership working. And then the third main finding I had, main method I used, was I set up a systemic inquiry across Wales. I attended multiple different cross-sector networks and I interviewed people from volunteers to Welsh Government to try to understand that bigger environment, the wider culture that affects the PSB and other partnership works in Wales. And one key main finding, just to preempt the rest of the presentation, was that action research principles and methods of co-learning in a community of practice can transform the quality of our partnership working. But before I go on to explain the findings of the research, I wanted to pause just briefly to find out, what is your experience of partnerships? This is the first of our polls, and Jamie's going to put that up on the screen for you now. In this poll, I'd like you to just enter 1 or 2 words. You can put 1 or 2 in, click submit, and then put 1 or 2 more in and click submit if you like. In 1 or 2 words, how would you describe your experience of partnerships? Are they inclusive? Are they diverse? Are they a shared experience? Do they have dominant partners? Are they controlled by other people? I can see responses coming up now. Do external bodies take over? Just 1 or 2 words from each of you, just so we get an idea. And this is creating a word cloud. As more and more people enter the same word, we're seeing that in larger characters on the screen now. We'll give it a few seconds to get a few more responses. And then Jamie will save that as a word cloud for us that we can come back to at the end. At the moment, it looks like challenging is the primary characteristic. No partnerships. There are some contradicting things. Dominant partners, but building trust. There is some influence going on, but some of it's mixed. So it's starting to take shape there. So that's great. That just gives us a flavour of your current experiences of partnerships. We'll come back with a second poll later on. So I'll leave that one where it is now. If Jamie could save it, that's great. Thank you. So the second question I wanted to address in this presentation was, what did we find out about what affects our experience of collaborative partnerships? And theories of collaborative governance show that the ideal culture for collaboration requires 3 main elements: dialogue, heterarchy, and pluralism. First, dialogue. This is a 2-way communication that enables each partner to understand the strategic priorities, work programs, and strategies of the other organisations. But more than that, dialogue helps us to understand the interactions between our organisations, between our strategies, between our work programme. And secondly, ideal collaboration is heterarchical, which is more than shared leadership. It's kind of horizontal decision making, where each member has equal influence and is included in the decision making process. And by doing so, it creates a kind of mutual accountability amongst the partners. And thirdly, ideal collaboration is pluralist. Good collaborative partnerships are diverse. They include diverse perspectives from different organisations, from different levels of authority within organisations, and external partners' perspectives are also included in the partnership's decision making. So the views of citizens and community groups too. So that's the ideal, and it is very theoretical. Not surprisingly, the PSB's experience was slightly in tension with that, or very much in tension with that. PSB members were committed to collaboration and inclusivity, and there were instances and examples of dialogue, of shared responsibility and inclusivity. But and they were really proud of the way they'd engaged communities in their local wellbeing assessment, and they engaged with very small communities to really try and get that diversity of perspectives in the assessment of wellbeing. But as the PSB moved from its assessment to trying to agree wellbeing objectives, they encountered a number of different dilemmas that constrained their capacity to collaborate and work together. The first constraint or dilemma they encountered was that specialisation restricts dialogue. So members arrive at the PSB from their different organisations, and they've got specialist fields. Meetings at the board don't allow a lot of time for that in-depth conversation that you would need to really understand each other and how your programmes interact. And the timetable of the Act restricts that opportunity for dialogue still further. What we found was that the lack of dialogue and mutual understanding meant that members' priorities competed, and some organisations were described as lobbies. The second dilemma that the board encountered was that hierarchy prevented shared decision making and inclusivity. There was an implicit hierarchy on the board. Kevin has already explained that there are statutory members and invited members, and the statutory members implicitly had more influence over the choice of wellbeing objectives than the invited members. Members of the board had more influence over the decision-making process than their colleagues in their organisations or the people who had been engaged in consultation and engagement workshops. And then the third constraint or dilemma that the PSB encountered was because of that specialisation and implicit hierarchy, there was an assumption of managerial accountability to a lead partner's priority. The board established subgroups which reported to the PSB, and each subgroup was aligned to a particular wellbeing objective. So their plans for action had to show that they efficiently added value to that particular objective, rather than the subgroups having to show that they contributed to each of the wellbeing objectives, and still less so how their plans contributed to the concerns of every member of the PSB. And this specialisation, hierarchy and managerial culture was reflected to some extent in the language the board used. They talked of commissioning the work of the subgroups and of adding value to their organisations, which is the kind of language I suppose you would expect from a lead organisation that subcontracts work maybe to a third sector or private sector, but not really the language of partnership working. And in brief, the main consequence for the PSB was that it risked losing its democratic and legitimate authority over its local wellbeing objectives. and plans. So members of the board were frustrated at the lack of inclusivity in the wellbeing objectives and at the description of some organisations as a lobby. As the subgroups reported to the PSB, there were continual delays in reaching agreement on the plans for action. And because of this frustration and delay, the subgroups started to seek their authority and resources for action from bodies outside of the PSB. The subgroups' action plans started to reflect and become aligned to the priorities and policies of regional boards and central government, rather than reflecting the local wellbeing assessment and the consultation and engagement workshops. But because of the experiences in the research groups and my systemic inquiry, the other two methods I used, I don't think this was just the experience of a single PSB. So what I'd like to know is, well, what's your experience of partnership culture in this more specific sense than what we looked at originally? In the second of Jamie's polls, could you describe the dominant characteristic that you would use to describe partnership culture? There are three spectrums here. Is partnership culture, in your experience, a matter of dialogue and mutual understanding, or is it more specialisation and siloed working? Is partnership culture mutually accountable and horizontal decision making, or is it closer to hierarchy and top-down decision making? On the other hand, are partnerships that you're involved in, are they diverse and inclusive, or do they tend to have one or two partners controlling the conversation? So again, put one or two words and click submit. You can put some more. You might want to put three different for a different characteristic for each of these spectrums. Starting to see hierarchical, top-down, specialised coming up again, similar to the experience of the Gwynedd and Anglesey PSB, but this is not uncommon, and it does reflect the large body of evidence there is worldwide. It's not just Wales, but it will be interesting to see what else people have experienced. The writing's getting too small for me to read all of these now, but top-down and specialised, organisational are all fairly evident, controlling, hierarchical. Yeah, just give you a few more seconds to be able to add some dialogue, but hierarchical decision making and not always diverse. Yeah, okay, yeah. So there is, like with the PSB, there were examples of dialogue and inclusivity and shared responsibility, but we kept running into these dilemmas that constrained the capacity to enhance those positive aspects or those collaborative aspects of partnership culture. Great, well, we've had 50 responses to that, so I think that's a really good sample. Thank you. Jamie, you'll save that word pad, we can come back to it again at the end. Thank you. The third question, final, that I wanted to address now was perhaps a more positive one. What did we find out, particularly through the work of the core research groups, about how we can create a more positive, more enhance our collaborative partnership work relationships? In the core research groups, we combined the principles of action research with practical methods that create a community of practice or a shared learning community. What we were aspiring to was creating that ideal culture of dialogue, shared responsibility and diversity. I'm just going to unpack that a little bit for you. The three key action research principles that we aspired to were to be relational, critical and reflexive. Action research is relational. It aims to change the relationships between people, and in this case organisations, from being instrumental or hierarchical to becoming reciprocally beneficial. Similar to the idea of social capital, that we're reciprocal in relationships. Secondly, action research is critical. Participants in action research are encouraged to unpack their assumptions about other organisations and to examine how some organisations have more influence or power in partnership relationships than others. And how is that influence gained and how is it used? And particularly, how does that unequal influence disrupt our capacity to create those beneficial relationships that we're striving for? And thirdly, action research is reflexive. Participants in action research are encouraged not only to examine how other organisations constrain them, but how their own organisation constrains others' work. And more than that, to examine how do we interact with each other and how could we move from these constraining relationships to relationships which are more reciprocally beneficial. During my research, and it's been reflected in the first poll today, or this second poll today, I found that lots of networks across Wales understand this relationship principle. Yes, most networks are striving for better relationships between the individuals in the partnership, in the network, and to some extent between the organisations represented there. But what's not so evident are the critical and reflexive aspects of these action research principles. What we found, however, in the action research groups was that it was this critical and reflexive element that actually motivated us as partners to persist in the difficult challenges of agreeing a shared strategy and gave us ideas about how we could create more positive relationships between each other. Now, those action research principles, I think, are quite conceptual. And in practice, what we did was engage in 3 practical methods that create the key elements of a community of practice. What I mean by community of practice in this context is a shared learning community made up of specialists or experts from diverse fields, from different fields of expertise, who come together to address an issue that crosses the boundaries of each of their organisations. So like Christian and Kevin have already said in the introduction, a boundary crossing issue could be something like climate change. It could be something like adverse childhood experiences or childhood obesity. It's an issue that affects multiple organisations' work and can be affected by multiple organisations' work. And if we take a systems approach, thinking approach to it, we can see how it may be possible by working collaboratively to address that issue together. And now that's what I mean by a community practice. That's the focus of the community practice. So in the action research groups then, we engaged in dialogue, firstly to understand, increase our mutual understanding of each organisation's strategic priorities, their main work programmes and how those interacted. What we found really helpful there was to begin to map where each organisation had a work programme and which local areas each organisation identified as having high levels of need for their particular service, whether that was environmental, social, health or anything else. As we began to map our work programmes and the needs of local communities, we began to identify clusters where there were high levels of need and also multiple different work programmes in that area from different organisations. And by identifying just a couple of communities and visiting those communities, talking to local community groups about their experiences, their priorities, what projects they were involved in, we managed to find ways to set up joint events by using staff from each of the different work programmes and people from the community groups to come together to put on a joint event or make a joint project. Just short things, just small, just a trial, just to see what happened. And we found that enabled us to pool the resources of different organisations, without having to try and find additional resources. And it helped us very much in that critical reflection on, well, who has more influence in this event, and where do the outcomes lie, and how are they attributable? Who contributed to these events? And as we engaged in this dialogue and joint enterprise, we began to develop a shared language, which is the other key element of the community practice. And that shared language consisted of the different strategic principles of our different organisations. So we talked about ecological resilience and particularly ecological connectivity. We started to talk about the social determinants of health and particularly doorstep activities to address those. And we talked about community development and in particular assets-based approaches. And the main outcome for these research groups was that because we began to develop this dialogue and mutual accountability and democratic inclusivity, we managed to negotiate a shared strategy that changed the relationships between our partner organisations and motivated us to co-produce joint action with local communities, instead of trying to compete amongst our different priority areas. We called this strategy Wild Pathways. It was specific to the partners in those particular action research groups, because it responded to their particular work programmes and their particular strategic principles. But it is generalisable, and I have got more information on that strategy if you'd like to know about it. Put your email in the chat, or there's a link at the end of these slides which will be available on the Public Health Network Cymru website afterwards that you can follow to get a policy briefing on that strategy. So just to conclude, there are three main learning points that have come out of the observation of the Public Services Board and the work of the action research groups. We can enhance the quality of our partnership working in three ways. Firstly, we can enhance mutual understanding by increasing dialogue, and particularly by examining how our organisations interact. We found that using GIS digital mapping really helped us to visualise those interactions between our different organisations' work programmes and between the different needs of communities, the environment and the economy. Secondly, we can enhance collaborative working in a second way by motivating shared responsibility, by critically reflecting on who holds more influence and how is that influence or power used, and particularly how does that prevent us from reaching those mutually beneficial relationships. And we found that by pooling resources with each other, engaging with local communities to put on local events or shared projects, helped us to really uncover those different relationships of power or influence between our organisations. And thirdly, we can inspire a broader alliance within partnerships by basically combining the strategic principles of multiple partners in a strategy for joint action, which may be different from the specialist strategy of the individual organisation, but by combining them creates a strategy that benefits each organisation. And we found that we developed this shared language by mapping to understand the interactions between our organisations, and by holding joint events to understand how we influenced or potentially contributed to each other. So that's a really brief introduction to the findings of my research. There is a slide at the end of this presentation which gives you links through to further information and policy briefings about the research. But now we've got 10 minutes, quarter of an hour for some discussion. With Christian's help, I'll start by answering any questions that have arrived in the chat and any comments that you've made, and have a look at back at the word clouds. But while I'm doing that, have a think about a broader question. How could you build on these research findings in the partnerships that you work in? could you form a community of practice that uses these elements of dialogue, joint enterprise, and shared narrative? Are there perhaps partners within a network that you're already working in who could start to build that community with you within a wider network? I'll come back to that at the end. I'm going to stop sharing the slides now so that I can answer some questions. If you like, you are very welcome to turn your camera on and raise a virtual hand if you'd like to ask a question directly, but you're very welcome to put your questions in the chat.
Thank you, Elizabeth, for a really fascinating presentation. We've got a few questions, and we've also got a hand up as well. So I'll go through the questions first. So there was one question which asked you, could you just maybe just elaborate a little bit more about exactly what you mean by the action research groups in terms of who was involved with those, and just explain that a little bit further. And a bit of a corollary question from me actually around that was what was your role as the kind of researcher within that? So yeah, I guess that's a double question for you.
Thanks, Christian. The second one's quite tricky.
Yeah.
Okay, so yeah, the action research groups, as I said, the PSB members and North Wales Wildlife Trust, my other main research partner, helped me to establish these groups. It took us several months of negotiation with different organisations and different work teams within organisations, but the two core research groups had similar organisations represented at them, and they ran consecutively. So there were a variety of different levels of authority. There were people who were volunteers in the community, and there were people who were managers in their organisations, and there were chief executives involved. So they were really mixed in terms of authority and roles. In terms of the sectors, there were third sector and public sector and social enterprises engaged in these action research groups, but no profit-making businesses. Except for in the community groups, there were one or two profit-making businesses there involved in the joint events. And the organisations represented, well, from the public sector, there were representatives of Natural Resources Wales, Public Health Wales, the two local authorities in Gwynedd and Morn, which was where the research groups were held. And then from the third sector, there were local social enterprises and third sector infrastructure organisations, as well as smaller community groups who were putting on social prescribing or green prescribing type activities, which tended to fit with the context we were working within. And my role within those groups was multiple. It was one of the things that I had to really explore in detail. As an action researcher, you have to develop multiple different roles in order to create that balance between dialogue and critical and reflexive approaches. So trying to create relationships while at the same time being critical of power relationships is quite tricky. So at times I had to be an activist, at other times I had to be a negotiator, and at other times I had to be a boundary spanner and going outside of the action research groups to gather information that could feed back. And all the time I was reflecting on the work within the action research group with other strategic leads and other networks.
Thanks,
So
Elizabeth.
I hope that answers your question, Christian.
Thank you. That's great. So I've noticed Roger actually is showing his face here. So if we could unmute Roger, and if you want to ask your question, Roger, that'd be great. Are we able to unmute Roger at all?
Roger, we've given you access. You just need to unmute yourself.
Here I go.
Yep,
That's great.
Thank you. Really enjoyed your presentation, Elizabeth. It was fascinating. And I asked one question in the dialogue about the cluster approach, developing into ecosystems, generating collaboration, etc., etc. I bear the scars trying to create ecosystems in collaborations cross-border for Welsh European Funding Office. But one of the tools that I found very useful in promoting trust among potential partners and eventual partners was coming up with a knowledge strategy right from the start, that people were happy to share knowledge, that they were happy to not sort of compromise their core actions by sharing that knowledge. So do you think knowledge strategy is a good start point for potential collaborations?
Yeah, I would totally agree with you. And I think my very broad heading for that is the dialogical side of a network. Yeah. And I think that lots of networks in Wales are becoming increasingly good at sharing knowledge. And I think one thing that would help would be if organisations, rather than simply arriving to share knowledge and give updates to each other, try to work together on a joint project. I found that in more than this research field, but in other research I've been involved in, is that when you actually are forced to focus on, say, a joint grant application or holding a joint event in Aberdaron, then you actually start to understand how your organisation's programmes interact and what the key strategic principles you're using in that specific location are. And that's really helps us then, because what we found by sharing knowledge was that you can do all this lovely GIS mapping, but then you get a huge map of just Gwynedd and Morn, let alone North Wales or the whole of Wales. Where do you start? Well, what we found was that by focusing on a single project, it actually gave us an immediate start point. We were able to do that thing that the public services boards were really concerned about. We weren't just talking shops, we could take immediate action by pooling resources. And then we could build on our shared knowledge through that to examine more critically, well, how could we do more of this without constraining each other? So yeah, I think knowledge sharing is essential. I mean, it's the building block, isn't it? If we don't understand each other, we can't work together. So that's great. And I think particularly, you said the ecosystems approach. I think having an understanding of ecology and how organisms don't have to necessarily compete with each other, but interact reciprocally beneficially with each other. That would be such a revelation to some of us, it was to me, that to just understand that ecological approach to coexisting would be really helpful, I think. So, and I found that public health used similar words like resilience and ecosystems and meant slightly different things, but the similar concepts. So there's a basis for a shared language there, isn't there?
Thank you.
Thank you very much, Roger. We've got another question for you, Elizabeth. So just thinking about the Public Services Board's wellbeing plans, they can often be really broad-based and they cover many strategic priorities. So do you feel like that creating a more kind of focused vision enables better collaboration and partnership?
I think I'd say it's the reverse. I think that what I found in the first wellbeing cycle, from a very brief examination of PSB's wellbeing objectives across Wales, was that they were similar to the PSB in Anglesey and Gwynedd, that they were single objectives. So they were housing or poverty or Welsh language or flooding. They were particular objectives rather than being a broader strategic approach. And that's what being singular and specialist is what made it very difficult for the subgroups, for the PSB then to reach agreement on the subgroups plans, because Natural Resources Wales were really happy with the flooding maps, but the housing people felt, well, maybe this is going to constrain where we can build affordable housing, and that kind of thing. And they couldn't quite understand how, but it wasn't obvious how plans for housing were going to affect poverty or climate change, that kind of thing. So taking a more broadly strategic approach is helpful. But the dilemma of that then is that one or two groups did subgroups did try to be more inclusive and not so specialist and narrow in their approach, but it actually took them a very long time then within their groups to come up with a joint plan. So there is a dilemma there between efficiency and inclusivity. What we found in the action research groups was that we were able to shortcut that by taking a place-based approach, seeing where we'd combined it, work programs, turning needs into assets for each other, and combining very specific strategic principles to create a joint strategy. So it wasn't the whole of ecological resilience, the whole of the social determinants of health, and the whole of an assets-based community development. It was doorstep activities in this particular community to create these connections between these habitats. And that wasn't what enabled us to be mutually beneficial.
Excellent. Kevin, did you want to come in on this one?
Yes, just sort of support what Elizabeth was saying, really. There's no science behind the perfect wellbeing plan at the moment. As a point of fact, it's just worth knowing that the second round of wellbeing plans are being published this month. Just over half are being published already, the other half are to follow. I will, though, just reflect, I think most, if not all of the PSBs changed their approach over the course of the first round. I mean, we had Brexit and COVID and climate, nature emergency, which would influence this. But I think many of the first round of plans tried to hit all the priorities at once, tried to be diverse and were quite micro in nature, as well as the age-old problem of if everything's a priority, then nothing becomes a priority. I think they reflected, because of these crises, effectively narrowing down the broader themes, perhaps having smaller actions underneath that mutually benefiting those themes, was a more successful way forward. They're more likely to succeed. I mean, something I haven't said, but worth reflecting, these wellbeing plans are intended to be generational. They're not 3 to 5 year plans. They will be short-term action, but they are with a view to improving wellbeing over a generation or more. So you kind of need to have a stable set of priorities where possible. But generally speaking, those that had a long action plan regretted it.
Thank you.
But having high-level themes and goals is just as bad.
Yeah. There's a real kind of, I guess, sweet spot in all of this. Yeah. Just another, just a definitional question. I think this one probably goes to Kevin. Is just that distinction between public services boards and regional partnerships boards. And I just wondered if you could just outline the difference. We've had a question about that. Just that would be helpful, I think, for the audience.
Happy to help. Yeah, that's a really important question.
Yes.
I think sometimes partnerships seen as complex because it's not always obvious what a single partnership is doing. So it's a good question. So I've touched on PSBs already, but to summarise it, the PSBs have a strategic partnership of key local partners on a local footprint, by and large, so local authority, to improve well-being, defined as economic, environmental, social, and cultural. That can range from climate to housing to poverty to Welsh language. That's the whole range of issues of benefit of that area. Regional partnership boards don't describe what they do very well, but what they do is primarily look at improving well-being on a health board footprint from a health and social care perspective. So it is very much an integration of health and social care to improve well-being on a health board footprint. You will perhaps use your imagination already and see where there may be overlaps, and that is a challenge, but they should be mutual challenges. And if you look at the membership of both of those partnership boards, there's a lot of overlap, maybe not of individuals, but certainly of organisations. I can pause there, or I can go to a broader reflection question. What would you like me to do? But that's in terms of that question, that's really the distinction between those two.
We'll go with a broader reflection as well.
Broader reflection. I'll keep it brief. Elizabeth, I don't know if you have a view. So in terms of conversation, discussion, the interrelationship with a single PSB is really important. That collaboration, that integration is really important to success. Elizabeth covered that really well this morning. The interrelationship between, say, the PSB in the area, that's really important because there's knowledge to be shared, there's information to be shared, there's experience and challenges and overcoming those challenges to be shared. What happens in Paris may not be happening in Ceredigion, but it won't be that different. So that, we haven't got there yet, but that's really important to foster. And then you've got the, I'm going to use the word supra relationship between different partnerships, so PSBs and RPBs talking, and mental health partnerships and substance misuse partnerships and area planning boards and community safety and safeguarding. All these people often affecting the same, sometimes vulnerable people in an area, and dialogue between those is quite important. Now, I won't go into why they all exist. They all exist for quite important reasons, and nobody really wants to stand them down. But it just shows that conversation is really important. Sharing of information, sharing of knowledge is really important to really reaching those strategic policy aims. And it's tough. And action plans and structures don't quite cut it. Partnerships is the first step, I think. But conversation is really, really important. I pause there. That wasn't an official Welsh Government position. That's just what I have observed, a hypothesis, if you will.
Thank you. Thanks, Kevin.
And you
just
did ask
sorry, Elizabeth.
whether I had a view on that, Kevin. And actually, yeah, my response would be to quote a participant in my research from Public Health as it happened, which was the relationships between all these strategic partnerships is the stuff of nightmares. And it is a really complex landscape, possibly not as complex as England, but it is still a complex relationship. What I observed through the research was that while the PSB seems to focus, the legislation for the PSB, the Wellbeing of Future Generations Act, seems to focus to me on the drivers and determinants of well-being. The Social Services and Wellbeing Act seems to focus on the outcomes of well-being, mental well-being, physical well-being, social well-being. And in that context, the RPB, Regional Partnerships Board's health assessment, fed into the well-being assessment of the Public Services Board, who then had to go one step forward and produce a strategic plan that would then feed into improving the next round of assessments. So it was in terms of, I would see that relationship in terms of the PSB having responsibility for improving the drivers of well-being, and the RPB for ensuring that those drivers are converted into outcomes for well-being. But that might be a naive point of view. That is one way I think of looking at the relationships between these different boards.
Okay, and I don't think we've got any other questions, but I felt good, just a thought, and you mentioned it, Elizabeth, was around in terms of your own research and thinking about, as you said, to some of those kind of tools within systems thinking, and relating to that, getting that sort of joint dialogue. And I wondered if you had any reflections or observations about how, in your own research, how you enable people to kind of see those connections, because you've alluded to that a lot, about how, you know, that this one bit can actually influence these other bits of the system, and how you create that space for people to really see that. Yeah, I don't know is the short answer. But what we explored in the research was just initially, to get partners in a room together, you have to appeal to their primary interest. But actually, the first action research group was set up by reflecting a minority group's interest. So within the different sectors in Wales, the third sector and community groups are probably less influential than the public sectors, probably less well-resourced, so probably less influential. Within the third sector, volunteers probably have less influence over organisations and charities strategies than trustees and paid members of staff. So the first topic we looked at as a boundary spanning topic was, it seemed really unlikely, but improving wildflowers on road verges. Now, in 2017, this was not a popular topic. It was prior to Plant Life's major campaign, and it wasn't high on anybody's agenda, apart from volunteers in branch members in North Wales Wildlife Trust. But actually, by taking that topic to Natural Resources Wales and finding out what they weren't engaged in road verges at all, but they were interested in partnership working, and they were interested in active travel and access to natural habitats. And so by building from the most minority interest to include more majority interest, helped us to retain that focus on
the most oppressed in power terms. And that we found was a really useful approach. I've used a similar approach with a group of academics and practitioners to create a partnership or a network which we call SPARK, Social Prescribing Assets and Relationships in Communities, which we used as a boundary spanning topic co-writing applications for grants, research grants, and we found that helped us to pool the practitioners' experiential knowledge with the academics' knowledge and develop an assets-based approach to research that built on both sides. So I think that was, yeah. You're on mute, Chris.
One final, thank you for that, Elizabeth. We've got one final question we'll take today from Roger again, who's on camera. So over to you, Roger.
That's kind of you, and Elizabeth really drew my attention to when she was talking about the drivers, and then she mentioned social prescribing. Because the question I'd like to ask, there's never been a time when ordinary people, were subject to so many consultations, and I'm finding some of the issues arising from that very confusing. We've got the accelerated cluster development plan with its means of consultation. We've got CLICE now with its methodologies, and we've got the individual consultation methodologies of partners. Do you find this is an issue that you have to contend with when you're forming action groups, etc., etc.? But that's both to Elizabeth and Kevin, please.
Thank you.
I found it was raised as an issue within the Public Services Board that they felt that there was consultation fatigue. I think that might be linked to the label of being a talking shop, that people, that we don't often say, you said, we listened, we did. That the we did is quite often not so easy to pinpoint, even if your organisations have really taken account of your views. It is really hard to show what we've done to help address them. One approach that I've seen used successfully is for public bodies to join in existing events. Don't try and set up your own individual consultation, but join, where does the local choir meet? Which is the biggest and most diverse community group in this area? Join their meetings, go along to their event or activity, like we did with mapping our work programmes and assets and needs. So find out what's happening in the community and where they'd like you to meet. And then that seemed to be a positive approach. And I've seen that used by Natural Resources Wales in North Wales in their consultation on climate change adaptation plans.
Thank you, Elizabeth. Any final observations, Elizabeth or Kevin, that you'd like to share with our audience today?
For me, very brief. This is really hard, but it's still worth persevering with. I think this is better than the alternative of just sticking it to different agencies. So you do your bit, you do your bit, and separating it out. But it is, yeah, it's hard. It's not a bad thing, but it's hard, but it's worth persevering with.
Yeah. Elizabeth, any final observations or thoughts?
Just to put the challenge out now. When you leave this meeting, spend 5 minutes reflecting mindfully on how could you build on these research findings. This research took 6 years. There was a lot of commitment and resources from Wales into it. How could you build on those findings? Can you create a community of practice? Can you become more critical, more reflexive, develop those positively beneficial relationships? I've noticed a few comments in the chat. I'm very happy to have a brief chat with any group that wants to set up in this way or start to redevelop or recraft their relationships in this way. And just contact me through my email address, which will be on the presentation slides.
Many thanks, Elizabeth, and thank you, Kevin. It was a really fascinating presentation, and we got some really good, interesting questions. And thanks for setting the challenge to the audience, Elizabeth, to really reflect on what you've described. We'd be really grateful if everyone who's joined the webinar today could complete a short evaluation afterwards, and a link will be included in the chat bar and will be sent to you. And if you're not already a member of the Public Health Network Cymru, then we would really be pleased if you did join. So thank you once again to Elizabeth and for Kevin for giving it time for a really fascinating presentation. And thank you everyone for joining us this afternoon. And if you have any final thoughts on webinar ideas that you'd like to share with the network, then please contact us. Diolch yn fawr, thank you.